Hi everyone, welcome to part 2 of preparing for dialysis. My name is Osman Khawar, this is Ask the Doctor, and welcome to our videos. It's been great to see so many people watching our videos for part 1. In part 1 we talked about preparing for dialysis and we were talking about education and modality choices, and today we're going to talk about access. Access is a very important piece of starting dialysis. What is access? Access is the method we're going to use to do your dialysis. Any access for any type of dialysis, we need a minor surgery. There's two types of dialysis, as you know, hemodialysis and peritoneal dialysis. For hemodialysis, you have three options for access. Option number 1 is a fistula, the best option. That's what you want to try and get. Option number 2 is a graft, and option number 3 is a catheter. Let's talk about each of those. A fistula is when you take an artery, you connect it to a vein, and that's done by a surgery. So you go and see normally a vascular surgeon. The vascular surgeon takes you to the operating room and he cuts one of your arteries, normally in your arm, either at the wrist or at the elbow, connects it to a vein. That artery is a high pressure system, connects to a vein which is a low pressure system, and we increase the amount of blood volume and pressure in the vein, and the vein becomes bigger and bigger, and after about 6 weeks it's ready, or what we call mature. It doesn't always mature in 6 weeks, and so it's important that you try and get your fistula placed well in advance of needing dialysis. Normally I advise people when their creatinine is over 3 or their CKD4, chronic kidney disease stage 4 or more, that you talk about getting an access placed and get it done as soon as possible. Another option is a graft. Not as good as a fistula, but still a very good option for hemodialysis. A graft is when instead of using your own vein, we attach a piece of essentially plastic that is biocompatible, and this vascular surgeon again attaches this artery to a graft, and the graft then to your vein. And then needles are placed into either the fistula or graft, and those needles allow blood to go into the dialysis machine to allow you to get dialysis. Again, a very important thing, grafts don't need to mature, so you can only put this in about 2 weeks before. Grafts don't normally last as long as fistulas, and there's a program in the United States called Fistula First where we try and get fistulas in as the primary access for hemodialysis. And it's a very important piece. If you don't do this and you end up getting hemodialysis urgently, then we put a catheter in. As well as fistula first, a lot of nephrologists talk about catheter last. A catheter for hemodialysis is not a good option. A catheter goes into your vein, normally in your neck, a vein over here called the internal jugular, and it's placed, it can be done very quickly, it can be used immediately. And for people who have not seen a nephrologist or not followed the nephrologist's advice or haven't got time to do surgery before needing dialysis, then this is placed. The reason we don't like catheters is infections. Large number of infections can happen from getting a catheter, even up to 50% at 6 months. We don't like catheters at all. So, catheter last, fistula first. If you want hemo, get a fistula placed. Get it placed as soon as you can when you're stage 4 or your creatinine's over 3. Now there's another kind of dialysis, that's called peritoneal dialysis. In peritoneal dialysis, we don't access your blood, we actually access the abdominal cavity, this section over here in your abdomen. And what we do is we place a catheter from the outside going into your abdominal cavity, and it sits basically in the area where your intestines are, above the bladder, and it just rests there. We fill your abdominal cavity with fluid, and to do that we need this catheter placed. Again, it's placed surgically, but not into a vein or artery, it just goes into that cavity. Now the PD catheter normally can be placed as a buried PD catheter for several weeks or months, even before you need to start peritoneal dialysis, or it can be placed as an unburied catheter where after 2 weeks it can be used. In some more sophisticated centers, we put a PD catheter in and we use it straight away in something called urgent start PD. All very important information to think about when you're preparing for dialysis. So you've already made your modality decision. If you want hemo, we want a fistula. If you want PD, we want a buried or unburied PD catheter placed well before you start dialysis. Remember, this access is your lifeline to dialysis. It's a very important step, and it's one where many patients unfortunately miss lots of opportunities. So make sure you talk to your nephrologist, see a vascular surgeon, and get your access placed. On the next section, we'll talk about transplant. Thanks again for watching this show.